Hello everyone, I am Dr. Abhijit Whatkar. I am general and laparoscopic surgeon working as a senior consultant with Noble Hospital. Umbilical hernia, in literal terms, it means your umbilicus is popped out. The main complaint which a patient comes up with, your umbilicus, which is actually inward, is now outwards and it is now popped out. It is most commonly seen as a congenital variety. That means the umbilical hernia is there since birth, but usually by the age of 2 years the umbilical hernia gets settled on its own, it gets obstructed on its own. But when it continues more after that, the patient comes up with umbilical pout or umbilicus which is outside. There are other causes of umbilical hernia as well. That means chronic cough. If the patient has been coughing since long time, or the patient is having lung diseases since long time, that time the umbilical, which is the weakest area in your abdomen, pops out. If the patient is also having any abdominal pathologies, or if the patient is a habitual constipation, then also patient tries to push too hard while passing stools, and again because of increased abdominal pressure it pops out. Also during any abdominal surgeries, if it is done in the past, and if any minimal access surgeries in which the umbilicus is used as the first port for access, that time if the closure is not good, or if the post-operative care is not properly taken, that time the umbilical pops out. Now the decision to go ahead with a treatment of umbilical hernia, it completely depends on patient's complaint. Many patients nowadays are coming up because of there is dull aching pain, because hernia carries out some part of your intestine and the covering over the intestine and the fat content, that means peritoneum, omentum and sometimes bowel loops inside your hernial sac, and the patient gets a dull aching dragging type of pain at the umbilical pout. The second commonest complaint which a patient comes to us is it's not looking good, sir, for cosmesis reason. That time we have to go ahead with a surgery. The treatment basically remains surgical. There are no conservative approach. That means there are no medications available, and medications are not at all required when it comes to hernia, because hernia is an anatomical or a muscle defect. Whenever there is a muscle gap, then it will not get filled up with medications. You have to go ahead with a surgery. The investigation of choice in certain scenario is ultrasonography of an abdomen. Basic sonography will tell you the size of the defect, the contents of the sac and other pathologies which is there inside your abdomen. When the all investigations are done, the ideal choice and ideal treatment for umbilical hernia remains minimal access surgery, a keyhole surgery as we call it as, or a sutureless surgery where we put an absorbable sutures. When we go inside the abdomen, we have to put dual mesh, and the mesh which is used to strengthen the anterior abdominal wall from where the defect is arising, we have to put a dual mesh to clear all the adhesions there obviously, and to fix the mesh from inside. To fixing the mesh, we have to use an absorbable suture material, and the patient can be easily discharged the same day. It's a daycare procedure where a mesh is placed from the abdominal side, that is from inside, dual mesh placed, abdominal defect is closed and used with a absorbable tracker, and same day patient can be discharged. However, after operative, few complications are expected if patient doesn't follow a strict instructions which is given by the surgeon. Like patient has to wear an abdominal belt. Abdominal belt will give some rest to the abdominal muscles for proper healing. Here at Noble Hospital, we have 6 operation theatre. 2 of them are completely dedicated to minimal access surgeries, and we are all well equipped with high definition cameras and camera systems for minimal access surgery. Thank you.